Welcome to another episode of Health Matters with PA Lynn Szabo. I'm Heather Pullen, your host. We have a very special guest with us today.
A great guest.
An amazing guest. This was a great find, Lynn.
Yeah.
We have Melissa Nelson, the patient navigator with AEGIS, on the phone with us today. And you have a list of questions, and she's got some answers for our community and what's going to take place here. So go ahead and take it away, Lynn.
I'd like to start off by saying, can you introduce AEGIS to the community? Because people have been driving by across the street from Big Five, and they've seen, the signs kind of evolving, and they've seen something happen at the building. What is the intent? What services are going to be offered there?
Yeah, absolutely. And happy to be here. Thank you for having me.
Mm-hmm.
So AEGIS Treatment Centers is outpatient treatment, and we're specifically medication-assisted treatment for opiate use disorder. So we offer medications in an outpatient treatment setting to assist people who are looking to be free from their addiction to opiates.
Oh, awesome. And so aren't you guys kind of, this is a little bit of an outreach from a Eureka site, right?
Yes. So the Crescent City location is actually going to be a medication unit. So it's an extension of Eureka. Eureka is the home clinic and will still be fully functioning there. But what's happened is that we've actually had a large number of Crescent City patients. And over the years, that has grown and expanded. And so we saw a need, specifically in the Crescent City area, because we have such a large number of patients commuting daily from Crescent City to Eureka to be able to receive treatment services. And of course, there's a lot of consequences to that and inability to maintain consistency and stability in treatment because of that drive. Yeah. And so now with this medication unit, we'll be able to better serve the community in need in their hometown.
So this sounds to me like maybe there's an initial evaluation, maybe in Eureka, and then a plan put in place, and then somebody kind of follows the plan up here. Is that what I'm getting, or is this something that can be done in its entirety locally?
It's for sure something that can be done entirely locally.
Nice.
Right now, though, the best way forward is for the medication unit, just because to establish and build an entire facility that is independently operated just has a different process to it than an extension.
Now, just to jump in here really quick, when you say a medication unit, do you mean like a mobile unit, or do you mean like a building that's kind of like a satellite office of what's in Eureka, and the people are going to go into the building and take care of what it is that they need to take care of for their treatment and then go on about their life?
Yes. So we actually did look at building a mobile medication unit like you're talking about, but we weren't able to do that for various reasons. So this is a brick and mortar independent medication unit. What that looks like, so our counseling, so there's a lot of pieces to this. So
sorry, go ahead.
First of all, when I say medication assisted treatment for opiate use disorder, that's a lot of words. So what that means is that if someone has an opiate use disorder and they are physically dependent on an opiate already and they are interested in treatment services, we are an option for them. So this is individuals who maybe are not able to access abstinence-based programs like inpatient treatment because maybe they can't leave their job or their kids for an extended period of time. Or maybe they've attempted abstinence-based programs but haven't had success, or they find withdrawal especially uncomfortable, or maybe it's not safe. There's a bunch of reasons that this type of treatment modality may be an appropriate fit, but the number one thing across the board that's true for all of our patients is that they already have an opiate use disorder. They're actively using opiates. So that is the specific demographic that we serve. Yes. Sorry.
So, I'm sorry. Go ahead. Go ahead and finish what you were saying, Melissa.
Yeah. And then in terms of what that looks like as a treatment modality is it's multi-part. It involves counseling. So regular counseling with a substance use disorder counselor, and then also daily medicating, as well as in the beginning, regular visits with the physician to ensure a therapeutic dose is reached. And then over time, those visits can stretch out with the provider, but in the beginning, we want to make sure that the patient we're serving is reaching a therapeutic dose level as quickly as possible so that they are able to be stable in treatment. What a therapeutic dose looks like is absence of cravings and withdraw for a minimum of 24 hours and not feeling that discomfort that one would get from a short-term acting opiate when you're going into withdrawal every 4 to 6 hours. But the biggest piece I would say about this type of treatment that a lot of people don't know exists is the counseling. So we have, I don't know I want to say over 14 counselors, but 2 of those are early recovery specialists that operate in person and via telehealth. And so every single patient that comes into our program is assigned to a counselor that works with them on individualized treatment programs and also is a plug-in and good resource for a bunch of other referrals in the community. So while they are working on addressing addiction specifically within those counseling sessions, they're also able to refer out.
So that's a one-on-one.
Yeah.
That would, sorry to interrupt. Yes. That's a one-on-one individualized, because oftentimes in the community clinic level, they have like a group therapy thing, but this is more personalized.
And we have that as well.
Yeah. Okay.
Yeah, we do have groups as well. But so that was a very long explanation for what a medication unit means, is that someone can get plugged into all of those services now being further away from the home clinic, because we can offer counseling via telehealth, meaning they can do that over the phone. They don't have to see the counselor in person, although they could if they wanted to. And they're able to medicate, so physically show up to the Crescent City location, medicate there, but not have to come daily to Eureka in order to receive their medication.
Oh, that's so amazing.
That is a phenomenal service. And so what it sounds like to me is you're talking about wraparound care for these, for the people who have this dependency. And then I have another question too. You did say something about working with the providers. Are you talking about the providers with AEGIS? Or are you talking about the patient's original primary provider for their medical care?
Or both, maybe.
Well, yes, but so what I'm talking about is that in order for a patient to change their dosage of the medication that they're receiving from us, they do need to see our in-house provider. And that can be done via telehealth as well. And how the dynamics of that work with the medication unit, I'm not super sure, because I'm learning as we go. This is the first medication unit that I've ever worked in as well.
Okay.
But those visits, so the sort of bones of what it looks like in the pillars of this type of treatment in the beginning involve that provider, regular communication and visits with the provider to reach that therapeutic dose level, as well as counseling sessions and medicating. The counseling sessions and medicating continue to be regular and ongoing, whereas the provider visits can get few and few between as that therapeutic dose level is reached, because there's no longer that need to see them as frequently once the individual is stabilized on their dose.
So I have a question about how a provider in the community might refer to this program. Do you have official referral process, or can the patient self-refer, or both?
Both. A
Awesome.
patient can self-refer. They can you can call me directly. You can schedule an appointment using our online platform. We also have a 24-hour line that's available. You could call our front office in Eureka. There's a lot of doors, and I'm happy to outline those as well. But basically, if you go to AEGIStreatmentcenters.com and you go to the Eureka location, that's all going to be on the main page there. The only thing that's not going to be on that main page is my personal cell phone. Well, it's a work cell phone, but the cell phone that I use for work that you can also contact me. And then that's helpful because I'm local, I'm here. And so if someone has questions or they want to understand more about what this type of treatment is and who's an appropriate fit, but they don't necessarily want to schedule an appointment, then I would be a good person to talk to. But other than that, you can just go straight to our website and then make a call from there or schedule an appointment.
That's amazing. So you've provided multiple outlets for people to self-refer, for their primary providers to refer, and then to find that information. You just kind of made it easy for those people to do those things. That's great.
Yeah. You made it easy. That's the opposite of barrier to care. Yeah.
Right. There's a provider form as well. So there's the self-referral form where you can just make an appointment and talk to our 24-hour admit team. There's also the provider referral, which is a bit different. But yes, both of those are available.
That's awesome. So if somebody, is this something where your providers will work with your patients' primary providers in Del Norte County to to manage their overall health, or is this just something your providers do for addictive health? So, I mean, if you're offering the counseling, is that something that their regular primary, just as an example here, because this is a weird question.
Yeah.
If Lynn's my provider and I need the services of AEGIS, is this something that Lynn can contact the providers with AEGIS and say, hey, how's my patient doing? I saw them for this. I have these concerns. My patient has these concerns. Or with the mental health issues of can we get them down to Eureka for one-on-one counseling and schedule those things? Is that something that is a partnership, or is these kind of separate care teams?
Well, it's sort of both. So depending on the level of need and depending on the ROI and the patient's desire and their
Level
acceptance
of privacy,
of cross communication like that, right? So it's really up to the patient. If the patient does not want us to speak to their provider, then it would be up to our provider to figure out how to move forward with that, I think. Let me think about this harder though. So it can happen for sure, but ROIs would need to be in place. We do work to establish an ROI for any provider if a provider exists. So if a patient has a primary care provider already, then that's something we're asking that patient at admit. Most of our patients, I would say most, don't have a primary care provider because we're in a medical desert. So there's that. So most of the time, and I want to be really careful with what I'm saying here because there's very specific protocols and procedures in place in regards to working with providers and that continuum of care, and ROIs are definitely a primary component to that. But most of the time, what's actually happening is the patient's coming to us without a primary care provider. They're working with our provider and a substance use disorder counselor that's making that referral out for the provider.
Okay, so then that would be the continuum of care and that connection. So if somebody shows up to receive AEGIS services and they don't have a primary provider for their overall health, you connect them with that resource and say, hey, this is a part of your healing. This is a part of your overall health, as you need to have annual physicals and check your blood sugars and your cholesterol levels and things.
Get care for your pregnancy, because I see that you guys see pregnant women. I think it's, is it during the third trimester only?
No, we see pregnant women throughout the entirety of their pregnancy.
So talking to the OB team is going to be important for care of the fetus after birth. So,
And I really like that you have the both options, right? You can do it without signing that ROI, or you can do it with that and have that comprehensive care team. I think it's amazing. I think this is a phenomenal opportunity for our community, and I'm incredibly grateful that you have recognized the need as AEGIS as a whole, and to come up here and to do a brick and mortar and to allow that and to remove that, like what Lynn was saying, to remove that barrier to care. It's just phenomenal. It just really is. So thank you.
So I think I remember from your website that you accept payers that include Medicaid, which is Medi-Cal or partnership here, Medicare, and then also private insurance. And you have a private pay option, which sounded actually kind of doable. So that's another barrier to care, is a lot of people here might not have insurance, or their insurance is making it difficult for them to get care here and there. Am I right about that? Are you really kind of that wide open and that helpful?
Yeah, we are, which is great. And it's even more so than that, significantly more so than that. So a big portion of what I do as a patient navigator is through the state opioid response grant. So my actual official title is a SOAR patient navigator, state opioid response patient navigator, which is grant funding that we have that can also assist patients who have an out-of-pocket cost but are not able to afford it for a period of time. So if someone comes to us and they perhaps have insurance, but they also have an out-of-pocket cost that is a financial burden, or if they don't have insurance, are not Medi-Cal eligible, and they are enrolling as self-pay but cannot afford that, then they become eligible for the grant for a period of time.
That's phenomenal.
That is beyond exciting.
Yeah. Melissa, I think you're going to be our new favorite person.
Yeah.
It's sorry, yes.
Oh, so another barrier to care that we kind of have in this community is for a community that's perceived as all white. We actually have quite a diversity of ethnic groups, including the Migrante community, so people that only speak Spanish, the Hmong community, so people that only speak Hmong, and the Native community, usually the Tolowa and Yurok Nation, but also to include Karuk, Hupa, and Wiyot, and probably more if you go north. So what kind of outreach do you have to these diverse populations? Do you have, for example, providers that can speak these languages?
We have, so I know that we have interpreter services. We do have bilingual providers on staff. We have a provider that speaks Spanish, and we also have a counselor that's fluent in Spanish. So we do have that. None speak Hmong that I'm aware of. Is that the name of the language?
Yeah, Hmong.
Okay. But we do have interpreter services. So if anyone is seeking out our services and we do not have someone on staff in clinic that is native speaker of their language, then we have the interpreter service that we work through.
Yeah, most native people can speak English, but there's a environment in taking care of native people that they feel more comfortable in, and one has to be sensitive to it. So,
right, totally. Yeah. I mean, in terms of if someone's coming in speaking a different language, like if their home language is different, then we can accommodate that for sure through our interpreter services. And then in terms of community outreach, we work a lot with the Yurok tribe and Tolowa, and beyond that, that's worse. And when I say work a lot with, what I mean is there are community events that I've been invited to table at, which I've been greatly appreciative of. And we do have, this reminds me about something else I wanted to talk about that I would have forgotten. We have
I do that all the time.
Display. Yeah, right. So we have a Narcan display with supplies, specifically Narcan and fentanyl test strips and xylazine test strips, available at the Rowdy Creek Boulevard tribal offices for Tolowa Dini Nation.
Wow. And you supply that for them?
Yes. And then we also have the same display with supplies at the Mission Possible office.
Awesome.
It's the one next to the convenience store.
It is the old convenience store. So that would be on Elk Valley and Holland Hill on the corner. Yes. It's a big red building.
What's been known as the Superette, kind of in local language. Yeah.
So there, and then also at the jail, in the lobby of the jail, and then also at the library. So anyone listening to this, if you're in need of Narcan or testing supplies, or you want to connect with me, or you want to learn more about our services, they act as little hubs because we also have information about our services. And I try to put other local resources there as well. If you're a service provider and you yourself have resources that are local that you would like to include on those stands, the top tier is just brochures and business cards. So please feel free to utilize that space. And then there are supplies as well.
Would you mind bringing some to Teen Clinic? We can connect later after the show, but that's another place.
Absolutely. Yeah.
That's another place that voice is needed.
It really is.
Yeah. Narcan flies out of there.
And it's good to have in the community. You never know when
it's totally
when you're going to stumble upon somebody who, if you just carry it with you.
Right. Yeah, absolutely. Most healthcare providers that I know carry it with them in their car just in case.
Yeah.
So this is super excited. Now, when can we expect the opening of your facility?
So we are still going through the licensing phase, I do believe. And so there is not a hard and fast date yet. I would say late winter, early spring, and that's being generous. So it could absolutely be sooner than that, but I don't want to throw out a date and then have it be later than that. Right. So my work cell phone number is 707-572-7586. And if someone is hearing this and is really in need and wanting to know immediately when we open, you can just call me directly, and then I can call you or text you once we have us.
Can you repeat that number for the people that are looking for a pencil right now? But
absolutely. It's 707-572-7586.
And that's with Melissa Nelson with AEGIS, and she's opening the outreach site in Crescent City, and we can all hardly wait. So Super exciting.
Yeah, and if you're a service provider as well, or if you have a local nonprofit, or if you are aware of somewhere that would be good for us to connect to, I am in town about once a week. It'll probably be more than that moving into the new year, but I'm available and accessible. Please reach out, let me know.
I would drop by the ER and introduce yourself. Also, the community clinics, which is a Stellant, but Del Norte Community would be a big one. UHS could be a big one.
Okay. Yeah. Thank you so much.
And I think there's an urgent care going in through Sutter, across the street from the Sutter Hospital. So, we can talk later. I can get you connections with all of those. Super exciting.
Can we get her connections to help remove the barriers to her opening the facility with her licensing so that she can get up here sooner? Because I think that's necessary right at this point in time.
Oh, completely.
Yeah, maybe we can talk about how we can help you get your licensings faster and connect you up with people that way as well. So when you talk about this is medication support. So my brain just tells me I'm not a medical provider. But my brain is telling me we're talking about Suboxone and methadone. Yeah, is that what you're offering for our local community?
Yes.
Okay.
Yes.
And this stops them from having to literally go every single day to Eureka.
Correct.
It's just phenomenal. It's amazing. I couldn't imagine having to drive 4 hours, let alone the time it took to, wait my turn to get my daily medication to function. How do you function with every 4 hours of your life every day?
Right.
Is taken from you just in travel and commuting to get medication that you need to maintain your job, to maintain your health, to stay clean and sober and
be productive members of society.
Honestly, 4 hours is generous. The reality of the situation is that the vast majority, and I mean vast majority, over 90% of our Crescent City patients are utilizing partnership transportation, and they're coming in groups. So there are not ride shares, there are taxis, but they're large, what's the word? Why can't I think of the word? So it's not just a single car with 3 or 4 people. It's a larger van.
They do. They have a large van, and they load the people up, and they start picking them up at like 4 a.m. in the morning. So this is a huge thing, and I don't think the overall community understands, right, that the partnership transportation, there's an expense. The expense and the taxing on the individual themselves, the ride sharing there, the having to be there at 4 o'clock in the morning to get picked up to go.
Right. What happens if the taxi guy calls in sick and there's nobody to bring you? What do you do for that day? There's all kinds of things that can go wrong. A tree falls, or there's snow on the bypass, or we all know that road. And we go down to Humboldt for stuff like going to Costco, but this is level of importance higher, and to have it be more available here is really something this community is not used to hearing. So,
right,
super exciting.
I think there's a little bit of a stigma around this too, that we think it's just homeless people, or we think it's just degenerates and things. But there are people in our community we would be shocked and surprised to find out that they are part of the Suboxone clinics, that they're doing methadone to maintain their health and those types of things. Professional, educated people. This is not just it's not just homeless people. It is not just people that we have decided to cast away and call degenerates.
And there is no methadone choice up here that I'm aware of.
I don't believe so.
I don't know of any prescriber that's prescribing it. Can you comment on that, Melissa? You guys?
Yeah, absolutely. So a prescriber is not able to prescribe methadone for an opiate use disorder as addiction treatment. So it would need to come from a clinic, like a methadone clinic, for example, and there is not one. There is not one. And to my understanding, there's none in Southern Oregon either. And I've gotten calls, I could be wrong about that, but last I checked, that was the case. Things are changing rapidly, though. I have gotten calls, though, from as far as Portland asking what to do for patients that are coming into this area. And there are just so few options, and addiction does not discriminate. There are all walks of life. And I've been doing this for, 11 years now. And 8 of those years I was a counselor, and it was a very humbling, interesting, and unique experience to get to work with such a diverse group of people over such a long period of time, because it really is vast, and it's every walk of life you could even begin to imagine. So yeah,
so it doesn't really fit the caricature or the stereotype that we're seeing on Facebook. Like, we don't want those people here. We are those people here.
We're already here.
Yeah.
Our people are already here. They are our families. They are our neighbors.
Right.
Yeah.
And is it possible?
Well, the reason,
I'm sorry.
I
Is
don't mean
it
to interrupt.
possible? Is it possible for people to come from Oregon and get treatment at your clinic? Let's say, Brookings is what, 20 miles north, about. Is it possible for somebody to cross the state lines?
Yeah, I mean, is it physically possible for them to cross state lines and seek out treatment from us? Absolutely. What does that look like logistically and with insurance? We're going to find out.
Right. Okay.
Wow.
I'm just not sure.
Well, the borders are always kind of leaky, and not all Native people even recognize the border as legitimate. So it's so exciting that you have a willingness to be available. It's amazing.
Melissa, we have like 4 minutes left here in this episode of Health Matters. Is there something that you really want the community to understand about AEGIS and the services that you're talking about offering to our families and our neighbors?
Absolutely. I would like everyone to know that we have a fantastic team. So our Eureka team, which is going to be who ultimately is serving our Crescent City population, mostly via telehealth. Although we will have in-person people, because it is a medication unit, we're still operating through our home hub, which is Eureka. And our counselors are fantastic. Our director, Sean, and our assistant executive director, Kenza, are incredible people, and I wish that I could put into words how grateful and appreciative I am to work for the team that I do, but I hope you can just hear it in my voice that I trust these people. I value what they bring to the table in regards to treatment services. I've been doing this for a really long time. I know what it looks like when people genuinely care about people and they're in it for the right reasons, and this crew is in it for the right reasons, and we're just happy to be here. We know that there's a need. It's the only reason we're here in the first place. And I hope that it makes life easier and treatment more accessible. And yeah, I trust and believe in these people, and I trust that others will see that in time as well once they get to know us and we become a part of the community.
Well, I appreciate you joining us today, and so that we could get to know you as the patient navigator and to get to know what it is AEGIS is doing and why it is so important for you to be here in Del Norte County.
Yeah, I was dogging you guys for a while. I was super excited. I was in Big Five for, just shopping reasons, and I looked across the street and like mind blown, and pulled over, took pictures, asked questions, watched Facebook, see who knew what, and I really appreciate you answering my, asking you to be on the show today. This is like water in the desert. Del Norte is not used to having resources. And we're different than the rest of Northern California. We do a lot of things really quirky. We're not the most literate people in the world, but this is the community where you can make the best difference.
Absolutely.
And this is going to do like an amazing amount of stuff. And I, on behalf of the provider community, I really, really thank you for the presence. And if you can pass it along to your team that needs to hear that, we can hardly wait for y'all to show up.
Melissa,
I will do that. Thank you.
Thank you so much for being here today with this episode of Health Matters. I appreciate what you're doing for coming to talk to the community. If anybody listening to this episode would like to listen to it again, to get the phone numbers, to understand the resources, what is being offered, whether you're a provider or you're a patient, if you're one of our neighbors who wants to know what's coming to our community and to understand it, you can always listen to this episode again on KFUG's YouTube channel. And we'll post this as soon as possible as we can to get that out there. We'll talk with Jessica and ask her to follow up with Melissa to do this story and to make sure that the community is aware. And I hope we get to talk to you again as it gets closer to you opening this up so that we can plan this out and maybe get to meet in person. Thank you so much for being here, Melissa.
Thank you.